for many years now, we've like separated every part of our bodies to like one type of care.
There are other models where there is isolation between providers, so there's more of a burden on the patient themselves. So I think the care that we give at Open Arms is really special.
My name's Juanita Perez. I'm the registered dental hygienist here at Open Arms.
I am Megan Markovich, and I am the pharmacist.
I am Sarah Schnocke. I'm the Behavioral Health Program Manager.
My name is Natasha and I'm a nurse practitioner. A lot of our patients have experienced a lot of trauma.
We see a lot of patients that aren't just getting treated for one illness or one disease state.
And so through integrative care and trauma-informed care, we're able to better assist the patient as they go through the healing process.
Integrative care is how do practitioners from different departments come together to care for the whole person.
For example, dental, I shouldn't only focus on the patient's teeth because their oral health is connected to their overall health, and so is their overall health to their dental health.
It's not uncommon to see a clinician kind of consult with a therapist or with a psychologist and what the best course of treatment is, or have a patient come to medical for one issue and then we consult with dental and see what the best course of treatment for that patient is.
All of the teams are working together as one unit. We all have to come together, and everyone is so open to that.
We're all created with mind, body, and spirit. And how are we as a team collecting our strengths and our experiences to provide care to that whole person, touching on each of those elements?
Wrapping the patient up in all different angles, behavioral, medical, dental, in one roof, be able to provide all of those services for one patient.
Oftentimes the patient will come in for something physical, and once they feel safe, they begin to open up, and curiosity will lead us to being able to treat the person as a whole.
The value of curiosity here is about truly sitting and listening to the people that we serve and the people that we see, and trying to understand their story first. Who are they as a human being before who they are as our patient?
By being able to communicate with them in their native language, they have been able to open up not just about like their medical history or about how they're feeling about their teeth, but many times they'll share their life experience, the struggles they're facing, and they open up and directly ask, I need help.
Having patients, whenever they come and pick up their medication, they always sit down with myself typically, and in that I've really developed some relationships with the patients. We've had a patient that had an issue with her leg. I was able to go grab one of our providers and say, hey, can you look at this patient? What are your thoughts?
So you can have someone who's coming to a mental health counselor talking about depressive or anxiety symptoms, and as they keep sharing things, including some of their medical history or what's been going on in their body, how they're feeling the anxiety, you begin to realize, I wonder if there's more to that.
If they're able to say, I already took care of my dental care needs, I am stable when it comes to my medical health or behavioral health, they will go on with their lives and they will be happy about, being healthy.
Successful integrative care would be when a patient has found true healing, when we address not just their physical symptoms, but we help the person truly heal.
I think what we do here is really special, and I'm just appreciative to just give our patients the best care that we can.
When we really provide whole person care is that person leaves with hope. At that moment, you are touching into their spirit, hope to walk out those doors, do another day, do another week, get to the next appointment where we get the sweet invitation to accompany them yet again. And that is truly, I think, the part where Open Arms Free Clinic is operating a little bit differently.